You're about to watch a short motivational interviewing video on how to approach your clinic patients in regards to weight management. One of the first steps in motivational interviewing is asking your patient for permission. Asking for permission is a great way to start a very sensitive conversation. Often when parents and patients feel that they have control of the situation, they're more likely to listen to what you have to say.
Wondering, since we have an extra time, do you want to talk about how you feel about your weight today?
So Johnny, this is where you are on the curve. Do you have any specific feelings about that? How do you feel about that number or fact?
Eamon did a great job showing his patient the BMI curve and asking him how he felt. By asking your patient how they feel about their weight, you're allowing them to come to their own conclusion, thus helping them internalize their need for change.
Well, Johnny, that sounds like it's very difficult that these kids are picking on you at school. There are little changes that we can make to help with this. Would you like me to offer you a few ideas?
So, based on the questionnaire you found out, I noticed that we're having difficulty with soda intake, physical activity, and screen time. Which of these would you like to talk about today?
Simone did a great job using the elicit, provide, elicit technique by asking Johnny what he thought would be the best way to manage his weight. Also, when you ask your patient to choose the topic that they're more willing to change, you're saving yourself a lot of time and effort because they're more likely to make the change when they're the ones choosing the topic.
Hi Johnny. So I heard you're trying to lose some weight. That's awesome. And you were saying that you wanted to try to cut down on soda. What do you think is a reasonable goal for you to do that?
Asking your patient for ideas is a great way to elicit change. Sometimes your patient may not be ready to make such a large change, such as eliminating all soda from his diet. However, to increase adherence, you might want to suggest a smaller change, such as eliminating soda to once a week as opposed to every day.
Okay, so maybe you can try cutting back your soda to once a week. What might make it that hard for you to do?
Kelsey did a good job using the problem-solve technique. It's a good idea to ask your patients about barriers that they may have to changing. If you can help them problem solve, then that just increases their chances that they're more likely to stick to their plan.
Moving forward, Johnny, do you mind if I call you in a couple of weeks to see how you're doing?
Stephanie did a great job concluding the conversation and ensuring an appropriate follow-up with her patient. This concludes our motivational interviewing video. Thank you to all the residents who volunteered, and I hope that you will all strongly consider using motivational interviewing in your practice.